Hello and welcome to World Coma Day 2025. I'm Brooke Mertime, an occupational therapist at Madonna Rehabilitation Hospitals in Lincoln and Omaha, Nebraska in the United States, and I'm the Brain Injury Program Manager there.
And I'm Amy Shapiro Rosenbaum from Park Terrace Care Center, which is a subacute inpatient brain injury rehabilitation facility in New York, United States. And I'm the program director there.
Well, today our presentation is going to look at knowledge translation and action and really focus on a relatively new coma and disorders of consciousness family and caregiver resource that we wanted to introduce to you. This has been a multi-year project for our group out of the American Congress of Rehab Medicine and the Disorders of Consciousness Task Force Family Education Committee. So long title there, but this is a project we've been working on for many, many years, and we want to share it with you with the goal that at the end, we're going to share this web-based resource with the World Coma Day attendees so that you can utilize it with your families that are experiencing coma and disorders of consciousness, regardless of what level of care that they're in. And we developed it as a one-stop shop for families for evidence-based, vetted, consumer-friendly information for education. So how this all started, we wanted to look at this through a knowledge translation cycle. And so in order to start, we had to identify, what do families need? What do they want for education? Where do they feel there are gaps? So we really had to analyze what's available to families as well as talk with the families about what their experience is of having a loved one in acute or chronic disorders of consciousness. So we interviewed families, but we also looked at the evidence. And so what does the evidence demonstrate? And this is reviewing a scoping review that was published in 2022 that, looked at a cohort of evidence, and what they found is that 40% of families and caregivers are a spouse or partner. They report range of caregiving anywhere from 1 to a full 24 hours a day. And they perceive burden of care, and it mediates negative outcomes for them as caregivers as far as their own personal health, anxiety, depression. Those that they looked at in this cohort of studies in the scoping review, 77% of the individuals that caregivers were caring for were still in a vegetative or unresponsive wakefulness state. Over half of these caregivers had to quit their jobs to be able to provide that level of care for their loved one. Other things that they reported, an ambiguous loss, we hear that all the time, that the person, their loved one is here, but yet they're really not. And so it definitely is a grieving process. There's also the socio-environmental and economic systems of care that they have to navigate, and that the burden of navigating the systems of care, regardless of what they are, can be very challenging and overwhelming. It definitely adds financial pressures, going back to over half are quitting their jobs to provide that caregiving, and then navigating changing relationships, not only with their loved one that they're providing care, but with others in their family. Additional pieces of evidence that look at caregiving and kind of provide us as clinicians and professionals recommendations for how do we approach caregiver and family education. There's multiple guidelines from the United States American Academy of Neurology guidelines, from Dr. Giacino and his group that came out in 2018. Along with that, an adjunctive piece that came out a few years later from the American Congress of Rehab Medicine with the minimal competency recommendations. The European Academy of Neurology and their disorders of consciousness and coma guidelines also address family and caregiver involvement. The UK and their guidelines from the Royal College of Physicians addresses caregiver involvement in education as well. Other collective recommendations and looking at all those evidence-based guidelines from those respective countries and organizations that have been endorsed by the European Academy of Neurology, the American Academy of Neurology, American Congress of Rehab Medicine, the Royal College of Physicians, is that it's important to provide high quality, accurate information to family caregivers that you need as an organization or as a team to have procedures in place to identify caregiver needs and education interventions that are individualized, and resource availability. So it's more than just going and talking to the families, but also providing resources, tangible resources for them to access. Other mandatory content is addressing diagnosis, prognosis, what are those immediate and long-term care needs for families, estimated length of stay and the level of care that they're in, and what are their options for discharge disposition.
Okay, so essentially what we have learned is that perceived level of support directly impacts on caregiver outcomes. And so among that perceived support, a big piece is the informational needs and the support needs that they have. We also have learned that there is an abundance of clinical practice guidelines that support the need to provide families with education and training. And so, in order to facilitate that translating to true clinical practice, we, as our group within ACRM, thought it would be important to try to create some form of a consolidated and simplified means of accessing all of this information so that they're not further overwhelmed by just trying to search and navigate through the abundance of content that might be available on online or wherever it is they might be looking. So the first step was to think about how that might be structured. Sorry. And so, again, going back to the research that we had done and the input that we had gotten through focus groups that we also did that we didn't talk about here, but we discovered and supported by research that not all information is created equal when it comes to caregiver needs. Some information is considered practical and desired pretty much from all caregivers from the beginning onto the entire course of the recovery, and that might include basic information about their loved one's care, information and treatment options, and other practical logistical aspects of information. However, there's a lot more variability in when families are ready and interested in receiving and processing more sensitive information, such as that related to outcomes, prognosis, long-term care issues, decisions regarding withdrawal of care. And understandably, this has been a particular challenge, especially when the withdrawal of care rules allowed for termination of life within 48 hours, pretty much before any family is really willing to consider that information. So, as an aside, it's a good thing that we have expanded those guidelines to 28 days so that it does allow a little bit more time for families to settle in and possibly be able to hear some of those more sensitive types of information that they need to. Um,
And Amy,
However,
can
mhm.
you just review the evidence back from the American Academy of Neurology, as well as the recent American College of Surgeons recommendations on those 28 days, just in case somebody isn't aware of those recommendations that may be listening?
Yes, indeed. So that was a recent change that was made, whereas I'm not even sure that there was a rule in place before, but if there was, it certainly allowed those discussions and moving forward with withdrawal of life sustaining treatment to occur within the first couple of days post injury. And recently, those guidelines were modified so that those discussions and actions cannot be taken prior to 28 days post injury, which allows a lot more time for a patient to possibly at least show a transition out of coma into vegetative state or other higher level of functioning. And if not, at least gives sufficient amount of time again for the families to kind of have a better understanding of these practical aspects of their loved one's care and what their needs are to make a more informed and calculated decision about what's best for them. So it was a really important move forward. Again, we're not going to get into the why of that, but ultimately, there's many reasons why that was beneficial change. But back to the topic at hand, the point here is that families are not unwilling to hear this information forever. Their needs do change over time as they move through the continuum, and so the goal really is to have a model of providing education that can be matched to individual caregiver readiness to hear it, as well as whatever their needs might change over time depending on what level of care they're at and what their particular care needs are at that time. So whatever model also needs to be flexible to be revisited over time. So we follow the model of timing it right. This comes from a study that was done on stroke caregiver research, but that conceptualized caregiver needs in terms of different stages of recovery. And ultimately, the main message of the story, which is applicable here as well, is that caregiver needs and readiness change over time, and a method of providing support needs to be adaptable, not only in the moment, but also over time. So in thinking about if not all needs are created equal and you have this abundance of resource needs, information needs, all the needs that were delineated as mandatory content under the guidelines, then creating a framework for them is important if you're going to create some kind of curriculum. So again, informed by the research that's out there. For purposes of our project, we decided to group these in terms of instrumental needs, which are really the hands-on practical needs, as well as resource needs, informational needs, which include things like diagnosis, prognosis, how to make decisions, and what is, dealing with ethical issues, things like that. From a procedures point of view and legal point of view, and then emotional and social support needs, which are obviously targeted towards alleviating caregiver burden, but also mitigating negative outcomes for caregivers. And so we went through the design. We ended up deciding to, or working with Brainline to be able to facilitate making this into a website, which is what we're going to show you now. Just to give a little kind of overview before we link to that, the website is organized as follows. So when we first grouped the information, we broke it down into the categories of mind, body, taking care of self, and resources. Thinking about it back to the structure that we just discussed earlier, the things under mind and body would be considered informational needs, some of which may be sensitive, but also a number of practical guidance on treatments, complications, assessments, so on and so forth. And then the categories of taking care of self and resources cover things like the support needs, as well as instrumental needs, practical needs regarding how to care for your loved one, how to access resources, and so forth. So without further ado, need that slide. I'm just going to stop sharing and reshare so that we can show you. If you're watching on screen, you could also shoot the QR code. It will bring you directly there. But for purposes of this little introduction, we just will walk you through a quick preview. So when you click on the QR code, it's going to bring you to this landing page. Of note, our funding at the time did not allow for breaking out this landing page quite how we wanted to, but in this year, 2025, our goal is to also add in tabs here for assessment, as well as treatment and prognosis, diagnosis and prognosis. So for people coming to the page, it'll be a little bit easier to navigate without having to go in this first umbrella here, overview, to get to many of the rich informational sections that we showed before. So if you see now, You have general overview, body and mind, as we saw on the slides, but also information on what to expect. And we'll just go in here just to show you. Again, later this year, this would be pulled out into a separate tab that could be directly accessed from the landing page. Why is it not letting me click on here? What's happening? Okay, phew. So in each of the pages, they're kind of laid out the same. I'm just going to show you one here, and then I'll show you one of the resource ones so you can have a sense. In each section, there's an introduction that was written by our team and vetted both through many consumers as well as expert professionals for accuracy and for readability of consumers. And so there's an introduction to the topic. You can also click within that topic if you're not interested in reading what we have to say. But then the essence of what we really have here is that we've tried to create is a hub that links out to everywhere else on the internet that contains reliable, accurate information on these topics. So, for example, you see we have content from the TBI model systems, from Brain Injury Association, from Craig Hospital. So each of these links, just to show you, goes out, farms you out to the website or the resource home where the information can be found. And so this brings you directly to the MSKTC website, to this fact sheet that could be read online, could be downloaded. Let me just get back to where I was here.
And all the content that is included within this Brainline resource is like a hub and spoke model where this is the Disorders of Consciousness hub, again, a one-stop shop, but then it's going to send you out to already available information. But we hope through how we have developed this in collaboration with Brainline and our sponsors is that, you know, it makes it easier for families and consumers to find the information that they need in less time, more accessibility, easier, hopefully less overwhelming. The other point, Amy, I think we should make too is that if you scroll up, that each heading or section that we're highlighting has a question, because we wanted it. Most families don't know what they don't know. They don't know what questions to ask. So we're very intentional in the development of putting it in a question form to hopefully cue families of like, oh yes, I have that question. And what are the evidence-based, embedded, reliable answers to that question?
Yes. And so, and then in addition to that, just to make it easy to navigate, you don't always have to go back out to the main hub page if you want to navigate beyond that initial question that you had. At the bottom of each page, they bring you back to those 4 main hubs, which again will now be 6 or 7 hubs by the end of this year. And the other thing I just want to show is the additional resources, because this one is further subdivided by the types of resources that it is. So you have a whole section of decision making, discharge planning, long-term needs, legal issues, advocacy, financial assistance, as well as the caregiver supports, social support groups, caregiver websites, books and resources, as well as information about our team. But just to quickly go here, because this is a big topic, not that people are necessarily doing research that early post-injury, but still, even for providers to be using it to assist them in educating their loved ones, that's really the essence of the tool. In the ideal way, this is, a family could use this on their own and navigate on their own, but just to speak a second on implementation, since we probably are at our upper limit of time here. But ideally, this is a tool that the provider, whether it's as a whole team or as an individual provider, first does a caregiver needs assessment to have a sense as to what that particular person's expressed needs are, as well as for the provider to have a sense of what they think the caregiver needs are, and then to provide that information to the patient, to the patient's family member or other caregiver, and to use the hub and these materials within the hub as tools to provide the education, to have them go and look and read it and come back to facilitate the conversation. And again, also to help link them directly to resources for assistance, because if you're in each section, it also will provide them with direct additional content, for example, Medicare here, interactive Medicare, on how to actually, what a healthcare proxy is, and how to go about putting one in place. So in a nutshell, that's essentially what the essence of the site is. Our goal is to continue to work with global partners to try to maximize the global relevance and utility of the hub. Obviously, a little egocentric, just having started it in the United States. We knew American resources best, but the goal is for it to become a global resource. We're currently working with partners in Canada, and we also are hoping that through this venue and through this organization that we can continue to make sure that we are including resources for people who are in remote areas as well as people who are in other regions of the world.
Well, we wanted to just introduce that resource for you that is now live and available on the Brainline .org website. It's brainline.org /DC hub HUB. Please feel free to reach out with questions or contacting the World Coma Day committee. If you have further questions about this website for us, we would be happy to talk with you and collaborate or answer any questions that you may have. But again, this is a resource that, ideally can be used throughout the continuum. Again, some families may be more ready to look at the information and discuss it with their care team at various times versus others. But we hope this is a useful resource for you in your clinical professions, as well as for the families that you're serving who has a loved one experiencing coma or disorders of consciousness.
And a call out to any of the professionals out there, if you know of other resources or websites, organizations that are out there that are doing good work that we should know about, that we should be including links to, don't hesitate to reach out to us and share that so that we can make sure that we add it to the site. Thank you.
Thank you.
Have a great day.